Good morning, everyone. If everyone will grab their seats, we'll get started. Well, thank all of you for joining us for this September Chamber Forum. I'm Roy Williams. I'm President and CEO of the Greater Oklahoma City Chamber. It's my pleasure to welcome you. As you already know, today's forum will feature a very important issue for our entire community, and that's mental and behavioral health. The impact that it has on our community, the resources that are available that you're going to hear about, and what more we can all do to support the ecosystem of prevention, of treatment, and of diversion options that are available here. Before we get to that, I would like to recognize our signature sponsor, Cox Business. Please help me welcome to the stage Shamal Medawatij. Shamal, Sales Manager at Cox Business.
Hello everyone, Shamal Medawatij with Cox Business. We're truly honored to be the series signature sponsor. At Cox, we strongly support mental health initiatives through our Cox Charities investment grants. Over the years, we have supported several organizations that are focused on mental health. And you know, we do understand that this is a very important issue, and so we do everything we can to support the amazing organizations that are helping within the state of Oklahoma. Every spring, Cox Communications offers opportunities for nonprofits to apply for these grants. And this year, 2 recipients that received or that do provide those type of services were awarded these grants. Mental Health Association of Oklahoma and the Youth and Family Services of El Reno. You know, I do believe this is a very important topic to have in an open forum such as this. And I thank the Great Oklahoma City Chamber for inviting these esteemed speakers so we can learn more about these issues, as well as how we can improve access to the resources that are available. So, thanks a lot.
Thank you, Shamal. I'm also pleased to recognize our corporate sponsor, ADG. Thank you, guys. So thank all of you for supporting the Chamber. So, over 4 years ago, back in 2015, the Greater Oklahoma City Chamber contracted with the Vera Institute of Justice out of New York to really explore the factors that were leading to a very extremely overcrowded county jail facility. And one of the many things we found was that mental health and substance use issues were major contributing factors to who was in our jail. And since that time, our community has truly rallied around this issue and continued to discover the many ways that mental health and substance use challenges have impacted our community. We're seeing people and organizations convening in really unprecedented ways to address these issues. And as most of you should know, just a few weeks ago, the Oklahoma City Council voted unanimously to support the inclusion of 2 new mental health crisis centers, a new restoration center, temporary crisis housing, and a diversion hub as part of the MAPS 4 package that will appear on ballots on December the 10th. Now, those items, in addition to some of the incredible work being done to address the mental health needs in the lives of our students as well, are being taken on. And they show that our community is not just ready to tackle these issues, but that our residents and our leaders are already taking the important steps to ensure that our transformation story applies to everyone. So I'm very excited to dive more deeply into all of this with you during our panel discussion. But first, please enjoy lunch, and I'll be back shortly to introduce our panelists. Thank you. We're going to get started, so please continue your lunch. Please continue to enjoy your lunch. We'll just talk louder. The panelists have their biographies are in your program, so I'm not going to read that to you, and we want to get started. So please help me welcome the panelists. First of all, Carrie Bloomer, County Commissioner for Oklahoma County District 1. Carrie. Debbie Hampton, President and CEO of United Way of Central Oklahoma. And Terry White, Commissioner of the Oklahoma Department of Mental Health and Substance Abuse Services. Terry. So thank all of you. And panelists, thank you for being here. This is like being on the stage with the rock stars. We got the people here who are in the trenches, but also exhibit significant leadership in all of these subjects. So we're going to get right with it. And to my near right is Commissioner Terry White. So let me begin with her. Give us an idea of where we stand as a state, really, in terms of mental health and substance abuse issues, and what are some of our biggest challenges at the state, and how does it impact the people?
So for mental health and substance abuse in the state of Oklahoma, it is the biggest public health issue facing our state. And it's the biggest public health issue facing our state for a couple of reasons. One, it affects 1 out of every 4 of us. 1 out of every 4 of our family members, our friends, our co-workers, members of our community of faith, men and women who've served our country. 21% of adults in Oklahoma will struggle with severe mental illness each year, and 10 to 12% will struggle with addiction each year. So what that means is it's between 700,000 and 900,000 Oklahomans each year. That's what 1 out of every 4 looks like. So that's the first reason it's the biggest public health issue. But the second reason it's the biggest public health issue facing our state is because the only barrier standing in the way of us being top 10 completely as it relates to mental illness and addiction in a good way is that our door to get into services is so narrow. We actually are ranked in the top 6 in the United States for the outcomes for people who can get into treatment, for people who can get help. We use evidence-based practices. We are a national leader in innovative payment structures that actually pay for outcomes. We have the largest public mental health telemedicine network in the United States here in Oklahoma because we have so many rural areas. The only way we can reach them with psychiatrists is through telemedicine. But we only, of the 700,000 to 900,000 people who need help each year, we only let 1 out of every 3 of them in the door. The door is too narrow. We serve about 195,000 Oklahomans a year. And when I say serve, I don't mean the Department of Mental Health and Substance Abuse Services delivers those services. We oversee a network of our providers, our nonprofits, of a host of people across the state that are doing the in-the-trenches work. And that's still only 1 out of every 3 people. No matter how hard we push for resources, no matter how far we stretch those dollars, and this isn't the fault of the current legislature, the current governor, or even the past governor. This is a result of decades of underfunding, decades of stigma around diseases of the brain and not understanding it, not covering it the same way under insurance that we cover other diseases. I cannot tell you how many calls I get from friends in this room, who have insurance, who have great insurance, whose child is struggling and they cannot get the help that they need. And many of you are nodding because you're actually people who have called me. So we have to make sure people have access to care. When people can get into care in Oklahoma, they can and will recover, and they can lead full and productive lives.
Great. Thank you, Terry.
Yeah.
Debbie. Many of your agencies, or the United Way of Central Oklahoma, are really directly engaged in meeting the needs of those with mental health and substance use challenges. Help us understand what types of services are out there, what's available in the Oklahoma City area.
You know what, first and foremost, the ladies on each side of me, we work hand in hand as it pertains to that, which really helps so we're not duplicating services, we're talking to each other, we're collaborating on what programs need to be funded. Last year, United Way put about $1.3 million into mental health, behavioral health programs, and we funded 19 nonprofits, 12 programs of those nonprofits. This year we'll put another 1.3 million of our campaign dollars into those services. I'm going to pick on one of our leaders. Bill Lance is co-chairing the United Way campaign this year with his amazing wife, Sherry. And so I'm putting him on the spot because we're set our goal at 17.1 million, so we'll know what we're going to fund for the next year. No pressure, Bill. None. But I had to throw that. One of the things that we've noticed, we have a research team. When I started at United Way just over 9 years ago, we would track what the top 3 needs in central Oklahoma and specifically Oklahoma City were, and it was always basic needs. You know, those food, shelter, clothing, always ranked at the very, very top. Now mental health has risen into that top 3 and has been for the last 4 years. And so we've got more people calling into 211 every day needing help for substance abuse issues, for mental health issues, and the numbers are continuing to rise. For lack of a better term, and not trying to be over dramatic, we're in a crisis situation and we need to really deal with it. It's our future workforce. It impacts our economy and how we treat our neighbors.
Thank you, Debbie. Commissioner Bloomer, both in your campaign as well as since your election, criminal justice and justice reform has been central. Tell us about how your experience has now been and what you're doing, and update us on any progress that maybe has been made at the county level, especially at the jail, in terms of justice.
Thank you, Roy. So, like Roy said, when I campaigned, this was my #1 issue, was local justice reform, especially our county jail, and that really resonated with voters. Almost every person, no matter how much they read the paper or how they didn't read the paper or didn't watch the news or did watch the news, they knew that our jail really needed some help. So it was a very big deal during my campaign. Since I've been in office, I have spent quite a bit of time inside our jail and meeting with the employees in our jail and meeting with our sheriff. And just to give you guys an overview of what is the current state of the jail, we've made a lot of improvements in the last few years. It's not as overcrowded as it was. Currently, on an average day, there's about 1,600 residents inside of our jail, 1,600. And again, on an average day, about 400 of those people are receiving some type of mental health medication, what you might hear us refer to as psychotropic medication. So 400 out of 1,600 residents are receiving medication for their mental illness. That means that there's probably way more than 400 people who need some type of mental health care, who might not know that they need it, or just might not have gotten access to it yet inside the jail. And as you might guess, the jail is not a therapeutic environment. It is not an environment where you can really become your best self or get well or live in recovery. It's a very, very tough environment. So we know that it's most people who have mental illness are, once they get out of the jail, that is when they're going to see the most benefit and the most recovery. Captain Gene Bradley is one of our current jail administrators under Sheriff P.D. Taylor. He has started a pilot project where he took a pod, which is a group of cells in the jail, and put some of our medium mental health need residents, and is bringing in lots of different programs, Celebrate Recovery, AA, therapists, and making this a pilot project to see if this is how we can run the rest of the jail. That is a new project that Captain Bradley has kind of spearheaded, and I'm really excited to see where that goes, and really excited to show that this is how the rest of the jail should be run. So like Roy mentioned at the beginning, the Vera Institute and the Chamber kind of started this big movement toward making big changes at our jail. And one of the biggest decisions that was made this summer, that doesn't necessarily have to do directly with mental health, but our jail trust, which was just put into place, the 3 commissioners voted to create a jail trust authority. There are 9 members on this trust, and they took a vote about a week or 2 ago to hire a full-time jail administrator. So that means that in the coming months, our sheriff will no longer run the jail. The jail trust will hire a jail administrator. And it will be extremely important that that jail administrator understands mental illness and addiction and understands how to structure a jail to better serve people with mental illness. So that is coming up. You'll probably see some big changes coming up at the jail related to that.
Thank you. Since you're already talking, I'm going to ask you to talk some more. As everyone knows, the City Council recently went through a process of MAPS 4 presentations and you represented a request to the City Council for increased mental health resources as part of MAPS 4. We're excited that a crisis center, restoration center, and transitional housing units will all be included should it pass on December the 10th. Tell us why those three were important to you, and what will they impact, how will they impact the system?
So both of these ladies helped with this proposal. So when we started meeting with different groups this summer and earlier this spring to ask them if MAPS could pay for something related to mental illness and addiction, what should it look like? What do you need as a mental health provider, as a law enforcement officer, as a staff member in the jail? What do you need? And the themes that we heard over and over and over were we need more safe places to take people who are in crisis that is not the jail. That is what we heard over and over. So that is where the crisis centers come into play. My staff and I toured the new crisis center. I say new, it opened in 2013, over by North Care. We toured it several times and asked lots of questions, and that location is full almost all the time. And it is not enough for our entire county only to have 1 or 2 crisis centers. So we proposed 2 mental health crisis centers in the MAPS package. And then we proposed a 3rd crisis center, which we are referring to as the Restoration Center. And that 3rd crisis center will be very focused on addiction treatment as well. We found a center in San Antonio called the Restoration Center and had several discussions with them. We're actually going to go take a trip down there this fall to see their center. And it is every mental health and addiction crisis service that someone could need. Medication-assisted treatment for opioids, treatment for meth addiction, crisis beds, a PIA, public inebriate alternative. So that 3rd crisis center will be very focused on addiction treatment. And then the housing piece that we proposed, another theme that we heard quite a bit was if someone is currently homeless and they get taken to a crisis center or they get taken to jail and they are discharged, they are probably going back to homelessness. And how can we expect those people to stay on their medication or stay sober when they don't have a place to live? That's almost impossible. So we are proposing 30 units of transitional housing for people who are currently homeless, coming out of crisis centers, coming out of jail, to stay in these housing units for 3 months, 6 months, 8 months, whatever that person might need, with the hopes of connecting them with more long-term living arrangements. So that is our MAPS proposal, and we are really excited about it. San Antonio has had their restoration center for about 10 years, and they have estimated they've diverted about 50,000 bookings from their county jail by having this restoration center. And their law enforcement there loves it. It really is a good fit for that community, and we felt like San Antonio and Oklahoma City had similar qualities, and so we stole their idea.
So we need to pass MAP.
Yes, please vote on December 10th.
So Commissioner White, most of what we've been talking about is about adults and things that impact adults, but we know there's other people who are impacted, and recently you have teamed up with Oklahoma City Public Schools Compact and the Oklahoma City Public School District to better understand challenges that impact our students in the schools. So what did you learn about what our students are facing?
I think this is an excellent question because adults with mental illness and addiction start as kids with untreated mental illness and addiction. And the effort that we are undertaking through what is called Embrace OKC, as you know, the Oklahoma City Compact is a partnership between the Oklahoma City Chamber, the United Way, Oklahoma City Public Schools, the City of Oklahoma City, and the Oklahoma City Public Schools Foundation. Those 5 partners are the key partners in the compact that came up with 4 different pillars they wanted to address. The second pillar they wanted to address was mental health. The first was literacy, Read OKC, for those of you that may have heard that initiative. The second is mental health, which we are calling our Embrace OKC initiative. For those of you that may have been on the elevator with me on the way up, a few of us were joking that we think Debbie Hampton has a chessboard at her house where she controls all of our lives. And she informed the Oklahoma City Compact that she and I would chair Embrace OKC and work on this mental health initiative. And then she called me and said, guess what we're doing? So we are leading, as the co-chairs, working with the Compact, what is called Embrace OKC. And this is really the deepest, widest partnership that we have seen maybe in the United States, certainly in the state of Oklahoma, but maybe in the United States, with a Department of Mental Health and Substance Abuse Services partnering with a school district, and our largest school district in the state, to really see what do our kids need in the area of prevention of mental illness and addiction, actually preventing these diseases in the first place, early intervention, so first signs and symptoms, and then deeper end. For those, if you think about mental health as a triangle, most kids hopefully being at the bottom of that triangle doing well and needing just preventative services or education, the top of the triangle where kids are really struggling and need treatment. What we found in Oklahoma City through doing what's called the OPNA, the Oklahoma Prevention Needs Assessment, an evidence-based assessment where over 80% of the students in Oklahoma City completed it, Oklahoma City's triangle unfortunately is inverted. And we have a lot of kids in crisis. We have a lot of kids who are struggling with psychological distress. We have kids who are struggling with substance abuse. And we have a high rate of kids who are struggling with antisocial behavior. But what we did also find in the OPNA is that the Oklahoma City public school students, one, had a belief in the moral order. And that came out very clearly in the survey. And that matters in the sense of kids believe that if you do the right thing and engage in the right thing, there will be positive consequences. And they also believe, the number 2 thing that came out was that they believe the school may be the safest place they knew. Which means if we tie our interventions and our prevention and our treatment to the schools, that's where they're going to feel safe and they're going to engage. And so we are doing a host of work with Oklahoma City Public Schools all around evidence-based prevention, treatment, intervention. And for those of you that are here today that didn't get to come to the forum that the Chamber held just a couple of weeks ago in the evening, we are raising money right now for Embrace OKC, and we are bringing resources to the table. We have already committed over $250,000, Oklahoma City Public Schools per year. Oklahoma City Public Schools has committed over $1 million, but that's not going to get us there. We are in need of raising somewhere in the neighborhood of about $5 million that will allow us to do this program annually until year 4, when Oklahoma City Public Schools says by then they will be ready to fund the program themselves, and they will ramp up. So if you want to be a part of decreasing people ever needing the jail as adults, decreasing services for crisis as an adult, help us get in Oklahoma City Public Schools and do evidence-based treatment, intervention, and prevention.
Thank you. So earlier on I said these are not just worker bees, they're leaders, and Terry just cited an example of Debbie being a leader, saying, you're going to co-chair this with me?
That's right.
That happens every day.
Every day.
So Debbie, since we're talking about Embrace OKC, tell us more about the goals of it, what kind of progress we're making toward implementation, and how is it really changing how the district has approached mental health resources, and maybe you could add to what more needs to be done with what Terry talked about.
You know, it's hard to add what Commissioner White has said, but you also know why I absolutely needed her as the co-chair. But I have to tell you, we're all, the Compact is really all in on this initiative, and we're not waiting until we have the entire amount. It's about $7 million when you take the total for the first year, and we're starting as the money comes in, and we're starting implementation, and the schools have already hired counselors and such and staffing. So it's started. We just need to do it right, and we need to fund it all, because again, I say this all the time and people hear me, those are our kids. They're all of our kids, and I keep saying we've got to invest in prevention. I wish David Prater were here and we could turn it over to David a little bit to talk about what he sees in his courtroom. And until we deal with the kids and the students in Oklahoma City Public School District and become the model that we can take statewide, we're going to still deal with the same problems. We're going to be up here again saying we need another MAPS 4, we need another this. We've got to stop it. We've got to find solutions, and that's what the goal of Embrace OKC is let's start in the largest, most complicated school district in the state of Oklahoma. We didn't start small, so if we can do it, and we will, in this district, we can take it statewide and be a national model, and wouldn't that be kind of fun for a change?
Thank you. I'm going to ask all three of you to answer this question, and Carrie, I'm going to ask you to answer it first, so you can think about it while I state it.
Like 2 seconds.
You know, we've talked about a number of programs and a strategy sort of behind those programs. But when you're doing this stuff and you're sort of peeling back the onion, you always sort of find stuff that you didn't know about, or it's a blind spot, or something else that you sort of wish, gosh, we need to start working on this. So in thinking about that, what's the one thing you wish more people knew about maybe mental health and substance use and treatments available or not available in our region?
So a couple weeks ago, and some of you were at this event, the Surgeon General was in Oklahoma City, and he said something that I will probably never forget. He said, we historically, as Americans, we have cut off our head from the rest of our body. Our insurance, your dental is separate, your vision is separate, and your behavioral health care is separate from your regular health insurance package. And I know Commissioner White talks about this all the time, that your brain is another organ in your body that deserves to be taken care of just like the rest of your body. And I cannot say that enough, I think, until we understand that. And a lot of the people in our jail, that's what I always go back to, they are there because we have cut off the head from the rest of the body, and we haven't provided them the care that they need. And like Commissioner White said, the door to get into receiving treatment is so small, and it's still very stigmatized. I know people who are very scared to say that they go see a therapist, or they're embarrassed to say that they're on certain types of medications. So we have come a long way as a community in recognizing mental illness and seeing it as a health issue, but we're still not there yet. So.
And cutting off the head's not a real good visual.
No, I'm sorry for that. Elder General said that.
But how true?
Yeah.
Terry or Debbie? Either one.
You know, I think it's time to make people a little more uncomfortable about the subject, and realizing, you know, I look at this group here, and I look at the folks that I get to see and work with every day, and you're amazing people, but we've got to start dealing with the tough stuff. And when you see that person on the street, that homeless person, I want you not to make eye contact. Look them in the eye and realize that's someone's mother, brother, father, it could be your sister, someone's family member. And when we start really looking at that and being a little uncomfortable, I think we'll start doing something even more about it, and realizing I have yet to find someone that can come to me and tell me that they have not had mental illness, substance abuse in their family, their friends, their co-workers, but someone that they love. And I think you need to really look differently at the folks that you see on the streets, instead of why don't they get a job, and realize that it is a disease, and that it is something we can do something about. So it starts with us.
I would actually like to build on what Carrie started talking about, and that is, I've already told you that the door is too narrow, and that part of that answer is we need more resources from the state and the federal government to serve more Oklahomans who have gotten to the point where they have lost their job and they have lost their home and they're indigent. But the other piece that we have to really start talking about in our state, because it will make a difference at widening that door, is having health insurance does not guarantee a path or an easy path to treatment. And that is a significant challenge of why our door, part of the reason our door is so narrow, is when health insurance is a difficult payer. And I'm not faulting health insurance, because we have some health insurance companies in Oklahoma who are doing some really innovative things, but somehow it's not all insurance companies, or it's not trickling down to the patient and family level. And patients and families are fighting or trying to find ways to pay for these services themselves. And that is a significant challenge that I think is going to become a much bigger discussion point over the next couple of years, because there are states that are tackling this, and we need to be one of those states that really talks about how, when you have health insurance, which shouldn't be disconnected from the rest of your body, how can those benefits actually get you good care for your brain health? Because all of those dollars invested are going to save us between 5 and 10-fold of those dollars on the backside, with not having to incarcerate people, not having children coming into the child welfare system, not having all kinds of things that we want to see different for our state.
Great, thank you. This is a question too for all three, and Debbie, I'm going to let you think about it while I'm talking about it. You know, we've talked about a lot of programs underway. We've talked about blind spots, but thinking more specifically around either a resource or a program, if you could magically add a new program to everything we're doing now, what would that be?
You know, I say this all the time. I get to work every day with some of the best nonprofits in the nation. Really, I put them against any of them. And I say it every day. We have the solutions. We really have them. We have incredible nonprofits. We have the government. We're all working together right now better than I've ever seen, and I've been doing this a long time. It just comes down, we need resources. So, you know, it's not really one program. I think we have the programs. I think we know what we need to do. If our agencies could just get the resources to do them, we could solve this. And so it really comes down to people getting involved and volunteering and getting engaged, and it comes to down to philanthropic dollars.
Mm-hmm.
Carrie?
Can I hear Terry's answer first?
You can. You totally can.
Yeah, of course.
Why didn't I think of that? Hear what Terry has to say.
I think Debbie is spot on. Resources really are the answer, but since people get tired of, that is my mantra, that this is the biggest barrier because it's been that way for decades, I'm going to add one to it, and that is resources also directed at prevention. I'll give you one example. There is an evidence-based gold standard prevention program for first and second graders called the Good Behavior Game. The Good Behavior Game has 40 years of research behind it. It's very inexpensive. We actually have a contract with the OSU Center for Family Resiliency to implement the Good Behavior Game in the classrooms we can pay for in the state, which are a handful. If we get the money for Embrace OKC, will be all first and second grade classrooms in Oklahoma City. We have a funder, a philanthropic donation in Edmond that has allowed us to put it in 120 first and second grade classrooms in Edmond Public Schools. We have cobbled grant money for some that are happening in a few places in rural Oklahoma. But that Good Behavior Game in first and second grade actually decreases the chances that those children will attempt suicide by over 35%, decreases their contact as adults with law enforcement by over 50%, decreases their rates of substance abuse or mental illness, which are preventable diseases in many cases, by over 50 to 60%. So investing in evidence-based prevention can make a huge difference, and most people don't actually even work in the field of prevention. Do not misunderstand what I'm saying. We need treatment because we've gone far too long and we have too many people in crisis, but doing prevention at the same time, we could significantly decrease our rates of mental illness and addiction in the state.
Now I'm
Was it
ready for
what
my
you were
answer.
expecting?
Yeah. So your question was, what is if we could have one resource?
Yeah, what resource or program, perhaps, if you could just have it tomorrow, what would it be?
My hope is that a lot of this will be addressed with what we're in Oklahoma City with what we're doing with MAPS 4, but I would love places for people to go where they bypass jail completely and our jail population is down to a couple hundred people. That would be my huge goal, and we only put people in the jail who really are a threat and a danger to the community. But right now, we know what programs work, but we don't have enough resources to divert people to other locations. So hopefully with the diversion hub and the restoration center and the work of all the partners in the community, that we will have in the near future more places for people to go to get help and to get treatment and just completely bypass our jail and never go there in the first place. So
Thank you.
I want to add one thing, because one of the words that we haven't said here but is so key, it's why the Good Behavior Game works, because it builds resiliency in kids. It's what is missing often when we get to the point where we meet someone in jail, and it's about how we build resiliency, because so many of our kids struggle with trauma in our state. And trauma can be in the form of many things. It can happen in incredibly wealthy, wonderful families. It can happen in really poor, struggling families. It can look like the loss of a parent. It can look like someone being a parent being incarcerated. It can look like child abuse or neglect. It can be a parent with untreated mental illness and addiction. It can be all of these host of things that are traumatic events that if we're not building resiliency in our kids, that's when we often see the development of mental illness and addiction. And we hadn't actually said the word trauma, so I wanted to make sure to say that.
Thank you.
And can I say one more
Yes?
thing?
Can we stay all day?
Oh, like I'm going to tell y'all no?
I want to introduce you all to Stormy. Stormy, can you just raise your hand? So Stormy is a participant in the Remerge program, and she is graduating next month. So if you all want to speak to her. So I want to bring attention to Remerge. They are an incredible nonprofit here in Oklahoma City that are really addressing criminal justice reform in an incredible way. They are working with women and bringing them all the support they need to get sober and to be independent. And it is truly a model program. So I just want to bring everyone's attention to Stormy.
They both got second chances. Debbie, do you want one?
Oh, of course, yeah. I'm glad you brought up, Remerge is a United Way partner agency, but I got to hear Stormy's presentation. United Way started a new social innovation grant, Wayfinders, and Remerge won, got the top prize, and Stormy presented and was stellar. So I just have to, there are so many of our partner agencies actually in this room, and they get it. They understand it. They should be up here on the panel because they are in the trenches every single day dealing with this. And Stormy gets it. Take advantage of using their expertise. And anytime here I go again, volunteering us, but the more we can get out and talk about this and we can speak to other groups about it, your employees, anyone, I think that it'll help with the stigma and all of the things we've been talking about. I think it just is education, because my experience, and I grew up in Oklahoma, is we take care of each other, and that's what we need to do here. So the more we can get the word out, I think we can solve this.
Thank you.
I think I'm done, Roy.
Are you? Yeah, right. I know you too well. You're not done. So I'm not a panelist, but I have a mic. So I'm going to say something. And it's really just a reiteration of what Commissioner Blumert said when she was talking about jail population. In essence, what we've done over the last year and a half, 2 years, we've reduced the county jail population by about 40%. And that was because we were smart. We began realizing there were things we weren't doing correctly. And so, you know, what you're hearing today are all of the other things we need to start doing correctly, and that it takes those kind of resources, because as she said, we can continue to eat away at this population that we're incarcerating that are essentially creating liabilities for our community instead of assets for our communities. And we really need great information here, and that's sort of your turn. I'm through with questions. We have allowed, I think, adequate amount of time for all of you who are probably wondering about something you haven't heard about or want to know more about something you've heard about. So we're going to open this up for a few minutes. If you would raise your hand, and a chamber staffer will bring a microphone to you so that we can all hear your question. So, questions of these panelists? Comment?
Someone think of a question.
Back there.
Hi, thank you so much for all you're doing. I'm with Valley Hope. We're a substance abuse treatment facility, but we don't take Medicare or Medicaid, and I understand your struggles with paying it. And my question is there any way we can partner with some of us in industry to help? We have lots of empty beds that we could put people in if we could somehow partner to get resources. Is there anything like that on the horizon that you all are thinking about?
So I'm going to answer, if we could get more resources, we'd buy every bed you have. Every dime we have is out in treatment. We actually have the lowest administrative cost of any state agency in Oklahoma. Only 3% of our budget goes to admin. So 97% of our dollars are out in treatment across the state. But I think what you may have been asking, and I may be wrong, but if I am wrong, pretend it's your question, because I think it's brilliant, which is, I think what you're asking is, are there businesses out there who want to help partner to make sure their workforce is healthy? And I hope that you all in this room as business leaders could start entering some discussions collaboratively about how can we keep our workforce healthy. It behooves you. 75% of people who struggle with drug addiction are employed. 85% of people who struggle with alcohol addiction are employed. The best thing we can do as employers, and I'm an employer, I actually have 1,700 employees myself, is make sure that they are mentally healthy and their brain is ready to work. And so I think that is an excellent discussion that maybe the Chamber could find another venue to further investigate around how could employers maybe come together and buy a few beds together that they had that they could circle workforce and employees through. Because I think that may have been what you were asking, and I think that would be fantastic.
It was a brilliant question.
I actually think that was what she was asking. I was kidding when I said pretend. I really think that's
And
what she was
thank you
asking.
for providing an opportunity for us to do some more.
Anytime. I'm learning from Debbie. I'm doing pretty good. Debbie's taught me.
And I think what a lot of people don't understand, and I was having a discussion at the beginning with representatives from St. Anthony's, from SSM Health, there are empty beds at places like Valley Hope and places like St. Anthony's, but people don't have the ability to pay. Right. We really have a lack of resource and a lack of beds for people who don't have the ability to pay for their treatment. And that's a crisis, like what Debbie was saying earlier. So if you might hear of people say, oh, we have lots of bed space. That's probably true, but they don't have the ability to take people who can't pay.
Right.
Or insurance doesn't
Or
cover.
insurance.
Correct,
Argue with them.
correct.
Right.
It's that head thing again.
Yeah.
That's right.
Surely somebody else out there has a burning
I
question.
think there's someone back there in the back corner. Maybe they didn't
Yep.
see him.
Hello, whoops, that's loud. I'm David Fritzy, Executive Editor for Oklahoma Watch, a nonprofit media organization. And we do a lot of coverage of mental health and criminal justice and domestic violence. In fact, we have a reporter here who covers a lot of that, Whitney Bryan. But I wanted to ask, if we pass MAPS 4 or proceed with any other initiatives, what are some of the measurables that we would use, the statistics or metrics to measure success?
You want me to try some of them? Or do you want
Huh?
you want me to answer some of those?
Answer, yeah.
So, Commissioner Blumert and I worked together on some of this discussion exactly. So, for example, the crisis centers, and part of this would apply to the restoration center as well, that's part of MAPS 4, since you used that as a specific example. What crisis centers do, if you think about let's think about a physical health care issue. In the community, we have hospitals, but people most times don't actually get admitted to the hospital. Most often when they're in crisis, they go to an emergency room. And most of people who walk into the door of the emergency room are going to leave the emergency room and do follow-up care somewhere else and not have to go into an expensive hospital stay. We've also developed urgent care in the community for those of us that are parents. When your kid all of a sudden has 102 fever, you can go to an urgent care instead of going to an emergency room, which is less expensive and gets you into the community faster. Crisis centers are the emergency room for mental health to hopefully avoid a psychiatric hospitalization, which is very expensive and very disruptive to someone's life often. Because unlike when you go into the hospital for something, if my child went into the hospital tomorrow for something, I would be at the hospital for the next 3 days with him. You wouldn't see me. But when you go into a psychiatric hospital, your family can't be with you. You're lucky if you see them an hour a day, and more often it's an hour a week. It's very disruptive. So one of the metrics is decreasing psychiatric hospitalizations, because that's going to save the state money. It's also going to help people get back to their life much sooner. But the other thing Commissioner Blumert did when she put this package together is she attached urgent cares to these proposed crisis centers, which urgent cares are 23-hour or less services, and 80% of people who can get into an urgent care for a psychiatric crisis never even have to go to a crisis center. So it's basically care on demand for people in crisis, where unfortunately we failed to give them services to keep them from having the mental illness in the first place, or failed to provide services to keep their mental illness stable, like medication that they may not be able to afford. But those are some of the very initial metrics that make a big difference. As you've heard in her restoration center, obviously she's talked about decreasing jail population as one of the most obvious metrics. What we also measure at the Department of Mental Health is people getting into housing and people going into employment. Because make no mistake, people in recovery work, take care of themselves, and take care of their families. So those are some of the other metrics that are really important.
Perfect answer.
Just the way you would have said it.
Yeah, just the way I would have said it.
I figured.
My biggest goal is reducing jail admittance and jail bookings of people with mental illness, and tracking long term of lowering that amount. So, and then everything Commissioner White said as well. So.
And thank you for asking a question, and thank you for Oklahoma Watch covering this issue, because I know you have for a long time, and we really appreciate it.
My question's for Commissioner White, and it's a structural question. We have very limited resources, and we have to use them carefully. Would it not be more efficient for the Department of Mental Health to administer and provide mental health services for our school children than to channel it back through the educational structure of the school system?
So I think that being a partner is what really needs to happen, in the sense that the school also has to be a leader, because they have to have buy-in. You have to have an entire school district, from top level staff and leadership to bottom level staff, that are going to engage with the idea that we're making a climate that's focused on mental health. So for us to just come in and do it, I don't think would really create the culture change, but I do think what's unique about the Embrace OKC project is it's us partnering with the school and really doing this together. And most school districts are not in that position, or we haven't had the ability to partner with them, for those that are willing to partner, because we haven't had the resources. So I think that you're onto something, that it has to be, we have to be part of it, because we know how to stretch those dollars to evidence-based services for mental health and substance abuse and track those outcomes. I mean, that really is our lane and our expertise. But we have to be partnered with the schools to do it. And we have a few school districts who've partnered before with us, but I think most school districts are either so overwhelmed, or the stigma's getting in the way. And then if every school district tomorrow said they want to do this partnership, we don't have the resources to do it. But I think what you're going to see with Embrace OKC is the power of what happens when you marry those two things together.
Well, and adding on to that, I mean, it's not, it can't just be one entity. I mean, you've got to have the nonprofit sector, you need businesses to wrap their arms around the schools, because part of it, too, is not just what happens in that school building, it's after school. Mm-hmm. It's when, you know, the child's walking to wherever they might be living, staying, sleeping, that we've got after school programs that we're all in it together. I don't know that you could have one entity take this on. And probably the beauty of Embrace OKC is truly the collaboration is beyond anything I've seen in the past. We really do. We're engaging the business community, we're engaging the nonprofits, the city. You know, Commissioner White has been all in to help with this. So I think you really do want that partnership. We've tried it before where it's one entity or government, and I don't know that it works as well.
My question has, that is loud. My question has to do with helping the caregivers, because my husband has mental illness, and he's been in hospitals twice, and both times I was just called and said he's ready to come home, but no one prepared me
That's right.
to help him when he got home. So I'd like to know about resources and what's being done to provide resources to the people who are having to live with these people and love them and take care of them on a daily basis.
I think that is such a great question. I actually have written down on here, and we ended up going a different way, about need for family support services. So one of the things we're doing at the department, and again, this is something, one of the things you can celebrate and be proud of Oklahoma for. We are leading the way in what is called peer certification, where we are really trying to engage, excuse me, a peer workforce, so that there are two types of peers. There are peers to talk with people who are struggling and in need of services, to talk to someone who's been through it, because people are more likely to engage. For example, when we're talking with a veteran who's been struggling with suicide, talking to another veteran who's gotten services, who's struggled, is much more likely to have that veteran actually engage in long-term services than hearing from a professional who hasn't served. And I'm using that as just one example. But we also are trying to continue to support the need and growth for our family support network, because you think about any other disease. If your child, God forbid, was struggling with cancer or those types of things, your friends are going to wrap themselves around you. People are bringing casseroles. People are trying to figure out how to help. You say your child was thinking about suicide, or your spouse or whoever, and people don't have a clue what to say. They don't follow up because they don't know what to do. Maybe it's that they really are, the stigma, but part of it is they just don't know what to do. And so this is an area we are really trying to work on and support people like NAMI, the National Alliance on Mental Illness, who offer family-to-family groups around the state where families go and talk to other families about what this is like. But it is still a gap that we have got to continue to grow, but it is something we are really trying on. I think it's an excellent point that you brought up.
I think if you're wanting resources right now, NAMI really is the best option. They have awesome support groups, like Commissioner White mentioned, so I can talk to you after if you want to.
And we know each other, so you know exactly. You can call United Way 211, and we will also help.
This side of the room's pretty quiet. Yes, right here.
Hi. So, Carrie, you and I have already spoken about this in the last week or so, but I just wanted to hear from the other panelists, and this is kind of a piggyback off of your question, around the need for trauma-informed work at all different intersections when we are working with folks who have experienced trauma.
So trauma-informed, not just care. We're not talking about just teaching the behavioral health workforce how to be trauma-informed, but the need for all of our locations, our school districts, to be trauma-informed and to be thinking about what may have happened in this child's life over the last week, as opposed to this is a child who's causing a problem in my classroom. For those of us that work in industry, as I said earlier, I'm an employer of 1,700 people, and what do I need to do so that we have on-demand EAP services and other things available for someone who's struggling, and how we offer those as opposed to simply disciplinary action for not showing up or whatever it might be, and not actually asking what was really causing this. So I think this is a really important point. I know for employers that feels a little bit overwhelming. I know it feels that way for schools, because everyone's trying to do what their initial primary mission is, and figuring out how to handle this seems a little bit overwhelming, but we have resources that we are willing to provide to workplaces for free to work on these issues through federal grants that we have to help understand how to be trauma-informed, or at least how to make sure you're connecting to EAP and making it okay for employees to even ask for help. We've had some amazing leaders in the business community. The very first partnership we did, and this was a decade ago, between us, Integris, and Chesapeake, when it was clear that Chesapeake realized this is an issue that affects their employees. This isn't an issue where they're just donating to help someone else. This was affecting their employees. They took on a huge anti-stigma campaign and made sure they had a good EAP program and shared messages over and over with their employees of how to access it, because that's when employees feel safe enough to do it. So it's an excellent question.
We want to honor your time commitment, so help me thank the panelists. Thanks very much to all three of you for your insight and for the work you do. Thanks also again to Cox Business and ADG for their participation. This was already mentioned, but I want to say it again. Oklahoma City residents get to invest in these programs to support mental health and justice reform as part of the MAPS 4 campaign. So on December the 10th, residents can vote yes on these 16 projects and really do some great things for our community. To show your support, either volunteer or join the coalition, visit loveyourokc.com. And most importantly, vote yes on December the 10th. On the back of a napkin the other day, I looked at the MAPS 4 projects, and depending on kind of how you wish to do this, if you sort of look at all of the initiatives that potentially impact this and impact criminal justice. It's about $250 million, somewhere around $250 million. So this is really a comprehensive package, and we really do need the community to step up and support this. So don't forget to vote. We hope you will join us next month for our October forum. We're going to do a deep dive into proposed investments in the Innovation District, which is also part of MAPS 4. Be right here Wednesday, October the 16th. We also want to make sure you're aware of Oklahoma's city's newest professional, the Chamber's newest professional development event called Elevate. On October the 23rd, you can hear from 3 keynote speakers, experience your choice of 50 different breakout sessions, and network at the Elevate After Party, where you can sample bites and brews from our best caterers and restaurants. As always, you can read about all this on our website and go to velocityokc.com. With that, thank all of you for being here today. Thank you for your questions and your engagement, and thank you for your support of voting yes at MAPS. We are adjourned. Thank you.